Hello, my name is Jeremy Kyneth. I'm a graduate student at the University of Texas at Arlington, College of Nursing and Health Innovations. This is a book review on the Innovators Prescription, a disruptive solution for healthcare, written by Clayton Christensen, Dr. Jerome Grossman, and Dr. Jason Wang. Clayton Christensen is a former Harvard Business professor after receiving his doctorate in administration from Harvard Business School in 1992. He has written 10 best-selling books related to business and disruption in business and has served under 2 former U.S. transportation secretaries. Dr. Jerome Grossman is a former CEO at Tufts New England Medical Center and has written many periodicals and peer-reviewed journals for the Institute of Medicine, as well as a Harvard professor and founder of the Centers for Business and Government Health Care Delivery Policy Program. Dr. Jason Wang is a board-certified internal medicine physician. He's a co-founder and chief medical officer of Icebreaker Health, now known as Lemonade Medicine, as well as the executive director for healthcare Insights Institute with Dr. Christensen formerly. The purpose of the book is to apply business principles that have not been widely used in healthcare to challenge the status quo of today's healthcare delivery model, as well as decreasing costs by increasing our quality and empowering the consumer or the patient to take an active role within their healthcare even more through the use of technology. The disruption that is spoken about is the use of technology to really form and drive healthcare forward. The audience for this is healthcare executives, healthcare marketing, as well as healthcare finance and reimbursement. The strengths of the books are that challenge to the status quo. Hospitals have been the center for our medical delivery, not able to focus on one specialty, but growing many specialties along with general medical care. Our physician practices really for many times have been processing just disease management, managing acute disease instead of really working to manage chronic diseases to a form and state of wellness. All of these are challenged by thinking innovatively as far as the hospital to look at smaller hospitals, more innovative solutions, looking at micro hospitals and those that can focus on certain disease processes that can take a very driven focus on them. Our physician practices really need to look at how they will think differently and meet the patient and the consumer at their home via telemedicine or other means. How we look to get people into wellness utilizing resources, nurses, and community, as well as that plays into chronic disease management. Again, managing our resources. They speak highly of utilizing our PAs, our NPs, and our nurses to drive healthcare forward, allowing physicians to manage things more globally and have a more global concentration. We really have a roadmap for pharmacy to the future. It really speaks about how pharmaceuticals will need to change, focusing more on research and looking at how we get people to wellness. We also look at medical and diagnostic equipment and putting that into homes and how we can link that back to our providers. The weaknesses at the time written, there wasn't a complete list of telemedicine services as provided today, as well as the application needs to be applied to 2020 as a whole. We have really moved a long way since 2009 and have moved into a much different global disruptive system, and further disruption needs to happen. This book really does achieve the outcome by looking at healthcare differently, how we have to do and models differently, because we've looked at a solution-based focus for too long in healthcare and not how we move forward into a area that advances forward and looks at how we not only fix problems, but how we prevent them and how we grow business while we reduce that overall overhead, because we will be able to utilize resources within our communities, nurses, and mid-level practitioners. The book is highly recommended for all healthcare executives, business executives that play a role into healthcare, as well as any leader, marketing, reimbursement, patient relations, because as technology increases, we know that innovation will increase, and we have to meet patients where there are. We, again, have to look at how do telemedicine practices work further, micro hospitals, as well as further looking at where we can meet people in a technological world that reduces cost. Again, I believe telemedicine will get us there. Thank you so much for listening to my book review, and have a great day.